viewer and listener. Welcome to Desert Mama Production, where we say we prioritize your interest. And that's why today we're going to do a topic on health, which is of great concern to many people. And I won't do the topic myself. There are people who are going to help me discuss that topic so that we can know something in depth. Joining me in that discussion is my colleague and an expert too, who is going to help us know more about whatever we're going to talk about. And before we go to our expert, I would like my colleague to introduce herself.
Hello viewers and listeners, I'm Barbie, and as Narubura said, we are going to discuss about UTI. I know most of you will go to the hospital, you are diagnosed with UTI, but you don't know the meaning of UTI, what causes UTI, and the effects that UTI can cause later. Narubura.
Yes. So, if our expert can hear us, hello Doc.
Hello.
Thank you very much for joining us today here at Desert Mamba Production. I would like to give you a chance to introduce yourself so that our audience can get to know you.
Okay, hello.
Hello.
This is Katinga. I'm a medical practitioner.
Mm-hmm.
I really appreciate for the invitation that you taken me through, and I'd love to enlighten you about the UTI.
All right.
And probably how to manage it in your case.
Okay, thank you very much. So to begin with the first question, I know many people outside there are asking UTI. Now, this UTI, maybe we've been hearing it, but we don't know what it means. Would you mind giving us a simple definition of UTI?
So, UTI, basically from the name itself, UTI is a urinary tract infection.
Mm-hmm.
But from the urinary tract infection, people confuse it with STIs, and back in the days, it was usually called a reproductive tract infection.
Okay.
Yeah, so there's a difference between the STI and RTI. But when you're talking about UTI, it generalizes everything. Both the STI and the RTI. RTI, the initials are for reproductive tract infection. Yeah. So why am I saying STI? STI is the way of transmission, the way the sexually transmitted infections are passed through from one individual to another. And for the RTI, when you're talking about the reproductive tract, that's the site of infection. I hope you understand me clearly.
A little bit confused because you've talked about RTI and STI, so we don't know if RTI is the same as UTI.
Okay, when you talk about UTI, you have to understand there are two things involved in urinary tract infections. One is the mode of transmission, and the second one is the site of infection.
Mode and site.
Yeah. Yeah, so people tend to talk about STI not knowing that majorly involves the way of transmission. Whereby RTI was a term used back in the days. Yeah, back in the medical days. Whereby RTI was the site of infection, where the infection actually developed. Yeah.
Oh, it's a bit complex, but anyway.
Okay, now that you've talked about STI and UTI, what about UTI and yeast infection?
What?
Yeast infection.
What about yeast infection?
Yeah.
How are they related, UTI and yeast infection?
when you have a urinary tract infection,
Mm-hmm.
on chronic condition,
Chronic condition.
whereby the infection has surpassed the incubation period,
Mm-hmm.
or it has surpassed the period that it's supposed to be within your body, and now it reoccurs.
Mm-hmm.
Yeast on its own is a fungal infection.
Mm-hmm.
Now this comes about if the UTI was not treated during the acute period.
Okay.
I'm sorry for using some medical terms.
Hey, you should be sorry. Okay.
Yeah, like the acute, when I'm talking about acute, is on the onset.
Mm-hmm.
Yeah, when I'm talking about chronic, that's when it's severe.
Mm-hmm.
Yeah, so when it's on the onset and it's not managed well,
Mm-hmm.
that's when now you develop conditions such as yeast.
Okay.
Yeah.
Now, back to UTI. We would like to know who are the victims.
Okay. For UTI,
Mm-hmm.
women are said to be more exposed, like
Mhm.
females,
Mm-hmm.
compared to males.
Mm-hmm.
Yeah. The major reason,
Mm-hmm.
you find women have a shorter urethra compared to men.
Mm-hmm.
So if you happen to be exposed, the bacteria multiplies
Mm-hmm.
upon exposure. It multiplies rapidly
Okay.
compared to men. Men tend to have a longer urethra.
Mm-hmm.
Yeah.
And what are the causes of UTI?
Causes of UTI.
Yeah.
There are many causes. Commonly, the normal ones that we know or what we've heard of is through sexual transmission.
Mm-hmm.
But other causes that are discussed when you're with your health practitioner
Mm-hmm.
are such as iatrogenic processes. These
What?
are medical procedures that
What?
may have been done.
Pardon?
We talk about iatrogenic.
Okay. What's that?
Iatrogenic is a process whereby
Uh-huh.
you've been attended to by a medical practitioner, be it a nurse,
Mm-hmm.
be it a clinician.
Mm-hmm.
And during the process, if he or she didn't use sterilized materials,
Mm-hmm.
you become mostly exposed. Because basically, if I'm to use unsterilized material on you,
Mm-hmm.
I'm exposing you to infection.
Okay. Before you proceed,
Yes.
you say the clinician or whatever using unsterilized material on you.
Yeah.
Okay. Which part, to be precise?
Which part? What do you mean which part?
Okay, like a clinician or whatever using unsterilized material.
Okay. When you're talking about the use of medical equipment by, let's say, a clinician,
Mm-hmm.
there are at times whereby clinicians would want to do a medical examination,
Mm-hmm.
let's say, upon hearing the patient's symptoms or the case at study.
Mm-hmm.
If she or he doesn't use sterilized materials during examining, let's say, the vagina or, let's say, the penis,
Mm-hmm.
the urethra,
Mm-hmm.
you're more exposed to be infected.
Mm-hmm.
Yeah.
All right.
And also, for I'd go at a higher bit for like when you're being connected from pap smear for women commonly.
When you're being,
Huh?
pardon, please.
I'm talking about during pap smear collection.
What's that?
Pap smear is a test for cervical cancer. And yeah, for women, and it also rules out if you have any bacterial infection. Yeah, if the procedure is not collected rightfully, yeah, it exposes you as a woman to infections like bacterial infections.
Okay. Those are now 3 causes. Are there any other?
Yeah, so we started off with sexual transmitted infection. We have the iatrogenic process, whereby that's more of the medical practitioners exposing you during procedures. And also we have the endogenous. This is more of the woman. Yeah, as a woman, you have something we call a normal flora. Like you have bacteria which are within the vaginal canal, but they are not harmful to you, unless now you hygienically you've been exposed. Then the bacteria could grow and could lead to something we call bacterial vaginosis.
Bacterial?
Vaginosis.
Bacterial vaginosis.
Yeah.
What's that?
Bacterial vaginosis, that's in the medical term.
Yes.
Infestation of the vaginal canal with bacteria. On this process, whereby we're talking about endogenous infection, the normal flora, like the normal bacteria within the vagina, if it outgrows due to hygiene or due to exposure to unhygienic kind of processes, like let's say you use a washroom, or maybe your pants weren't washed well. Yeah, it actually inhabits the bacteria to grow and exposes you to that bacterial vaginosis.
Okay, you said bacterial vaginosis.
Yeah.
And I've heard you talk of something to do with washrooms and panties. So my question is, panties, what exactly to do with panties causes bacterial vaginosis?
Now, when I'm talking about pants, I'm talking about the hygiene. You tend to sweat. You tend to be exposed, let's say, when you go to the washroom. Foreign material, stuff like that. You sit there probably. In terms of this, all this exposes you to bacteria, different kind of bacteria.
Yeah.
Yeah. Some might not affect you, but some do affect you eventually if you don't sanitize your pants well, you don't wash them, and you don't expose them to proper sunlight as expected. Yeah.
Okay, and what about, us ladies, we are being told, we are always told to shave our pubic hair. Can shaving reduce the UTI infection?
Yeah, if hygienically you're not good with the hygiene, like with the pants and everything. If you're sexually active,
Yeah.
it's highly advised to keep the place clean, because maybe your partner, you might be doing everything right, like the hygiene and stuff, but your partner might mess around, and most of the pubic hair carries a lot of things like sweat and any tiny bacteria that can't be seen by the eye. So to avoid all that, you're told to shave and keep yourself.
And I don't know if this is a rumor or what, but after sex, we are always told that you go and pee as ladies.
Even before.
Is this helping or
to reduce UTI, or what's the purpose if it exists?
Yeah. Should you pee after the sex and before?
Okay, peeing before sex, huh? So it doesn't really have that much effect, because by the end of the day, if you had any bacterial buildup within the urethra, it's going to be washed off. Huh?
Yeah.
But being after is more effective. Huh? Being after, because you've been exposed. Let's say if you weren't aware, you've been exposed. And now, if you go to the washroom, you're going to wash away any bacteria that were building up within the urethra. Just like I said earlier, women have a shorter urethra. So peeing assists us to cleanse the urethra.
Okay. Peeing helps to cleanse
the same with men. The same when you are advised after being sexually active. Go to the washroom too.
Okay.
I hope our viewers have
These are a bit complex. Let me now take a break from the expert to speak to the viewers, because there are quite a number of things.
You don't have a toilet in your house. At least have a container. Some of us, we don't have that toilet in our houses. And you can't run after sex at night. How can you run out? You go and pee, then you come back. Mommy, have something.
Okay. It's okay, fine. You're dwelling so much on that part. But anyway, there is something I wanted to make clear to the audience. There are things that we should know, or we always know them, but tunapuuza. First of all, hygiene. The expert has spoken about. He said, my friend, msichana, osha panty vizuri. Na uanike kwa jua. Yeah, that was the main thing.
Tuko na kamba kwa
ndani ya bafu. Unaianika. Sasa daktari amesema it is good ku-expose panty yako kwa jua. Okay, I don't know the reason behind it, but sikia advice ya daktari. It's good.
Sasa sana napenda seamless. Turudi kwa cotton.
Yeah, by the way, maybe doc, before tuache history ya panties and everything, kuna panties zimekuja siku hizi.
Okay.
Zinaitwa seamless. Sijui kama unazijua. Okay, not necessarily seamless. Sio seamless, zinaitwa thong.
Kwanza thong ni mbaya, inaingia.
Do they have any effect? Okay, before we proceed, unajua thong?
Yeah, I'm aware of the distance.
Okay, now iko na effect gani hii thong msichana akiva, ama iko tu sawa?
Okay, specifically it's been designed for some fashion, some kind of fashion in the bedroom. So, for women who are not undergoing, let's say, their menstrual cycle, I feel like they are more comfortable. It doesn't really expose them that much. But if you happen to be going through your cycle, it does expose you. I mean, you're bleeding, and also at the same time, your vagina is exposed. You're not covered fully. Yeah, so it's a risk factor for me, I'd say, when you're going through your cycle.
Okay,
but if you're clean and you know hygienically you're good, it doesn't pose as a risk factor.
Okay.
Okay, now that you've mentioned menstrual cycle, there's this thing called tampon. Tampon. Us ladies, we like it. Saa zingine form imetokea, uko on your period, so unaingiza. Iko na effect?
From the researcher's view, tampons don't have that much effect. That's why it's been put out there. But for some women, because we are all different,
yeah.
For some women, they feel that irritation.
Okay.
Yeah, it might come due to the chemicals that have been used in manufacturing the tampon. So you're not advised. You're not advised to use it. Supposedly, you feel you have a rash or discomfort.
Okay.
Yeah.
And again, I know we are dwelling so much on this, but we just need clarification. There are ladies, kuna nguo zingine zenye, okay, someone once said that kama demu wako hajui hazaliwa na panty, basi hajachanuka. Is there any effect ama disadvantage in kutovaa panty huleta? Like you're going somewhere, msichana unapata nimevaa tu toja yangu, nikavaa dress ama skirt bila panty, ndio hiyo mimi nikachomoka, kaende. Is it hygienic?
Okay. For women who feel they are hygienically well, like from your perspective, from the personal perspective, you don't have any discharge, you don't have any issue with your like the pubic area. I don't feel like you're really exposed at the time. Now, unless what you went outside there to do exposes you. Yeah, but you might tend to sweat. Just know how to clean that. You might tend to sit on something. Just know how to avoid such. Yeah. So I don't feel like it has that much effect.
Lakini umeongea you sit on something, hygiene, blah blah blah. Tuseme ulikuwa unaenda kaform kametokea hivi, msichana ukapata nguo yako nyingine yenye hufai kuvaa na panty kama wale mademo wamechanuka vile wanafanya. And then ukaenda ukapanda mat. Unajua vile unapanda mat, hujui nani alikaa hapo, alikuwa anakaa aje. And then umevaa nguo nyingine yenye ni kadogo. Then ukienda kukaa, hujakalia nguo, umekalia. Sijui kama unaniget?
Yeah, ndio maana hapo awali yeah, nimemention kitu kuhusu jinsi utakuwa umetoka kwa nyumba na what you're going to do outside. Yeah, if you're going outside to maybe board a matatu, probably board an Uber, yeah, it poses as a risk. But if you're just going outside to maybe probably watch a game, umesimama mahali, and you haven't encountered such, it doesn't pose like any major effects.
Okay.
Yeah.
Now, we've dwelled so much on women, and I think we should now talk about UTI in men.
UTI in men?
Yes.
Okay.
What should we know?
For men, men are less exposed. Like they are least exposed to urinary tract infection. But it doesn't mean that when you're least exposed, you can't still get the UTI. Yeah, for men, when you're involved in a sexual act with different partners, basically, that exposes you to HIV and other sexually transmitted infections, like the gonorrhea, the syphilis, the chlamydia. Now, all these will manifest when it's more chronic. Yeah, when you've been exposed to multiple kind of women and you haven't treated it, when you had an acute infection. Acute means when it was noticed that you had an infection, you didn't do something about it. Yeah. Now it becomes severe with time. You start seeing discharges, you start seeing blood in your urine, and you start having a condition we call as dysuria, whereby when you urinate, when you go for a short call, you experience the painful, like the pain during urination. I hope you're getting me. You're like, when you're going for a short call, you experience some pain when helping yourself out. Now, that's when we say it's chronic, when you see such symptoms. Yeah. Men, a lot of men, actually, I talk about Kenyan men, wanapuuza. They don't really go to hospitals when it's needed of them to go. Wanapuuza, na wakati pita ile muda tunaita incubation period, na ishakuwa severe, that's when now you run to the hospital. And still, as much as they go to the hospital, you might be assisted, you might be treated, but unapata tuna the same person who's under medication, bado tu anahanya, so it again exposes them.
Okay. Now, you've really talked about many things, and I think that one is taking us to our next step of the effects. Or let me say, mtu atajuaje akona UTI? Anaanza kuona nini? What are the symptoms, not effects?
Okay. Symptoms, with acute symptoms of UTI, basically for women, kuna some smell. You might feel some awful smell coming from your pelvic area. You can also experience some discharge. Not all the time, but you experience some discharge. And another thing, you can experience some pain, call it the pelvic inflammatory pain, below your abdomen. And as well, you can also experience the painful urination, whereby we call it dysuria. Yeah.
You call it?
Dysuria, painful urination.
Okay.
Yeah.
What about itching? Does it itch?
Yeah, that's one of the other symptoms. Sorry that I left it out. You might also experience itching. Also, inflammation around your pubic area, be it your labia or be it around your testicles, the penis. You can have something called a lump or a rash.
Wait, are we talking about men or women now? You have had something called sijui amesema labia, nikasikia penis somewhere, then I'm like,
Yeah, I was generally explaining about the pubic area. Yeah, like, okay, for women it's around the vagina, and with the vagina you have the vulva and the labia. You might experience a lump around there, and once you experience such, there's some medical tests for that. I think we'll talk about that as we proceed. And also, for men, you can also experience a rash and at the same time a lump.
Okay. Is there a way?
Huh?
Is there a way in which you can explain these things in a layman's language?
In a layman's language?
Yeah, like hata kama utatuambia na Kiswahili, unatuambia mtu anawashwa, anafura. Because you know ukisema lump, sijui what, most unajua kuna audience hapo wenye si madaktari.
Oh, so napaswa kuongea Kiswahili.
Sisi tunapaswa kuongea Kiswahili. Lakini mali unaona hata sisi tuna float, because I know you are asking yourselves, eh?
Yeah.
Sasa jaribu tu.
Kuna zile yenyewe
zinapita.
Yeah.
Hey.
Okay. So nitajaribu kufafanua kwa Kiswahili. Na yenye sitaweza kufafanua kwa Kiswahili, nitajaribu kueleza kwa Kiingereza. Yeah. So nikumbuka swali hapo muuliza symptoms, eh?
Yes.
Yeah. So back to the symptoms, naweza sema kwa wanawake. Nitaanza na wanawake.
Yes.
Wanawake wanaona kitu tunaita discharge.
Discharge.
Yeah, ile uchafu.
Ya kala.
Inaweza kuwa different in color kulingana na the condition yenye mgonjwa wako nayo. If mgonjwa ana happen kuwa ana bleed, yani anatokwa na damu at the same time.
Ile ya periods.
No. Kuna damu ya period na kuna damu ya infection.
Oh. So yeah. It is discharge accompanied by
spots of blood.
Yeah, some blood.
Okay.
Yeah. So utapata inakuwa either brown. Yeah. For some, kama hamna hiyo damu, it might also be yellowish. Yeah, and for some it can be a bit creamish. And yeah, wengi wana speculate ikiwa inakaa maziwa mala hivi imeganda, mtu anasema kuna yeast. But hiyo ni ku speculate tu until you are tested for it. So you might have una hiyo uchafu. Na pia unawashwa. Na pia wakati unaenda kujisaidia, unakuwa na ile uchungu wakati hiyo kojo inatoka.
Okay.
Na wengine pia tunaita inflammation, eh? Yani unakuwa na lump. Ni kama uvimbe, yani uvimbe around hapo sehemu ya siri. Yeah.
Okay, tumemalizana na wanawake. Sasa tuje kwa wanaume.
Yeah, kwa wanaume. Kwa wanaume unapata mwanaume ana complain sana hiyo kuwashwa wakati anajisaidia.
Sasa
mkoje na mchoma.
Mwanamume.
Yeah.
Unajua sisi wanawake wakati umeenda kujisaidia haja ndogo tunaweza sema it's open, unawashwa na wapi? Ama maybe mkojo inakuchoma or something. Now men, unawashwa na wapi to be precise?
Men is more of the same, eh? Because ukumbuke tunatumia njia moja kwenda for a short call, eh? Urethra. Yeah, so the same complaints we get from men, whereby unasikia anakuambia anawashwa wakati anaenda haja ndogo, wakati mkojo inapita anasikia ile muwasho ama kuchomeka. Another thing, pia wanaume wana discharge, yani uchafu huo inatoka. Now when wako na hiyo ugonjwa ama they've been exposed, Yeah, not necessarily. Okay, normally
Mhm.
kwa siku zote wanaume hawatokwi na ile uchafu, but wakati amekuwa exposed ama amekuwa mgonjwa, ndio utaona akikwambia nimeona uchafu ikitoka na nimeona iko na hii rangi na ni uchungu, nasikia, na pia anawashwa, na pia unapata pia kitu tunaita hiyo uvimbe around hapo hiyo sehemu ya siri, like the penis, yeah.
And how long does it take someone to realize that he or she is infected with the UTI?
The incubation period varies for different sexually transmitted infections, but commonly for women after, let's say, 7 to 14 days, if you have encountered an individual who has been exposed or who's not been treated, it might take you 7 to 14 days for you to start experiencing such symptoms.
Okay, na kuna most people unasikia nimetibu UTI this month, after 2 months nimetibu UTI, after 3 months nimetibu UTI. Why is it that UTI recur in some people?
Okay. When you're talking about your current, this is whereby you've been exposed to quite a number of drugs, and if you happen to follow up keenly, you're being exposed to the same type of drug over and over. So, what comes about by that, when you're being exposed to the same drug, the bacteria that actually affecting you mutates. Like ile mdudu ilikuwa na kuaffect, unapata inapata njia ya kukabiliana na ile dawa. Sasa ile dawa haina effect kwake,
kumaanisha imezoea hiyo dawa.
Yeah, in a way imeizoea. Sasa ile dawa haiwezi tibu. Yeah, hizi bacteria, they know how to manipulate their bodies to respond to different environments. Yeah, so ikiwa inajua hii dawa itakuwa inakuja inanipea an acidic state of an environment, it knows how to manipulate itself to live in such an environment. That's what we mostly call mutation.
Okay.
Yeah, so if it's able to live within such an environment over and over at different times, as much as you're going back to the doctor and being given the same drug, there won't be like any difference from the start of treatment to the time that you're still treating the same infection. So we always advise patients, if you've been exposed to the same drug over and over, liaise with your doctor or liaise with the person who's doing the follow-up with you, so that they can change the drug. Yani, wajue kama hii dawa haijakusaidia, they can put you on some other new drug. Na kama itakuwa ni shida, then they can also do a test. There's quite a number of tests that have been put out there, but the common one ya kuangalia mambo ya dawa kukuwa effective, yeah, tunaita mambo na culture, yeah, whereby we know there's a specific drug that can treat the specific bacteria at hand.
Okay.
Yeah.
I see time is not on our side. Maybe we just go through the effects of the long-term and the short-term effects of UTI.
The long-term and the short-term.
Yeah, if there is.
Yeah, the complications, huh?
Yeah.
Okay. For we can start for men.
Yeah.
We can start with men. Yeah, for men, the long term effect is whereby you can become infertile. Yeah?
Mm-hmm.
Yeah, it induces an infertility rate whereby, if not treated, the bacteria might inhabit your tubes, it might distort. Actually, inaweza haribu zile tubes ziko pale kwa sehemu ya siri.
Mm-hmm.
Yeah, so unapata kama ulikuwa uko na high sperm count, ina reduce the sperm count.
Okay.
Sasa hata kuzalisha inakuwa shida.
Mm-hmm.
Yeah, another thing pia una develop a condition whereby hata kupitisha mkojo inakuwa shida.
Mm-hmm.
Yeah, called the PID. Pelvic inflammatory disease.
Mm-hmm.
Yeah, so unapata hata kupitisha mkojo inakuwa shida.
Mm.
Yeah, and another thing for men, when it's chronic, unapata hauwezi kuwa na ile condition tunaita erection.
Mm-hmm.
Hapo imeharibu hata ile uwezo wako kuwa mwanaume. For women, basically, ina cause infertility at the same.
Mm-hmm.
Yeah, and also a condition known as ectopic. You've never heard about ectopic pregnancy, right?
Ectopic pregnancy, what's that?
Yeah, that's a pregnancy that affects the fallopian tubes.
Mm-hmm.
If you're not treated, it can cause a blockage in your fallopian tube, and that might trigger ectopic pregnancy. Yeah.
Okay.
And also, for some, it might also lead to abortion, like complications that might cause an abortion,
Okay.
like a miscarriage.
Mm-hmm.
Yeah.
Now we move to treatment.
Oh, to treatment.
Mm-hmm.
Once you've been exposed,
Mm-hmm.
you will need counseling. You go to the doctor. Daktari mwenyewe kibinafsi atakuelekeza for the right test.
Mm-hmm.
Yeah, why am I talking about test?
Yes.
Nowadays we have chemists that are exposing, that are not exposed, like they're exploiting individuals. Hao ndio watapea dawa, na wenye mwenzangu pale nimesikia akiongelea hiyo recurrence. Yeah, if you happen to be going to the pharmacy only for medication without really knowing what you're treating, then basically utakuwa unaendelea tu kutibu kitu haujui. So that's why you're advised to go to your medical practitioner, be taken through a test, be it a laboratory test, or be it an ultrasound. Once you've been assessed, then from there, you can be given the right prescription.
Okay.
Yeah, apart from that, personally practice personal safe sex, and also hygienically look at yourself, be able to manage. Another thing, whatever we eat, we're taught, take a lot of water so that you can go to the washroom.
Yes.
Yeah, take a lot of fruits. It helps to maintain with the pH. Yeah, I think I can conclude with that.
Okay. Thank you so much, Doc. And before we wrap up, is there anything that you think you should add?
Huh?
Is there anything you think that you should add to about this UTI? Anything left out?
Something that I should add to.
Yeah.
What I really add is management. Huh? Management is key. If you feel like you went to a specific hospital or like a specific medical personnel and you're not seeing any outcome, try as much to reach out to another individual. So Yeah, when I'm talking about funk, it's more of like if you had seen a clinician, try as much to see maybe a gynecologist. If you have been attended to by a nurse, try as much to go and see now the clinician.
Okay.
Yeah, don't rely only on one person, because by the end of the day, some humans are meant to do some mistakes on the line of job. And yeah, it actually exposes you as an individual.
All right.
Yeah.
We really appreciate for your time, and the session has indeed been wonderful, and I hope we've learned a lot. Personally, I've learned a lot. I hope the audience out there has also learned a lot. Yeah. Now, Doc, we can now end it at that point, and we really appreciate. In as much as we appreciate, we are still left with quite a number of questions that are unanswered.
I think it's due to time.
Yeah.
That we've not touched on a lot of things. But if we happen to get enough time, maybe upon your schedule, then you can be able to highlight anything that has been left out. Yeah, and we can be able to discuss as deep as possible. I appreciate. Yeah, and one thing I leave the audience with is try as much to practice a good hygiene. And when we're talking about good hygiene, it means more sexual, both sexual and personal.
Okay.
And with that, I think we can be able to wrap it up. Yeah.
Thank you very much, and bye.
I appreciate it. Oh, it's a pleasure.
Pleasure is ours too.
Yeah, and I hope we watch out for our health. In case you are sick and you have UTI, look after yourself. Tusiassume hizi vitu. Yeah.
And we've also been told the preventive measures, if you are closely following the show, and we've also been told the key thing, of which I doubt anyone would love to experience. Tumeambiwa UTI, the long-term effects in both men and women, it causes infertility. And I don't think there is anyone who wants that. And in men, there is something that he has said, and I know no man there would want that to happen. You can be very much disappointed. Tumeambiwa the long term of effect ya UTI kwa wanaume, no erection.
Correct.
Yeah, you know.
But in Nyarubura,
yes,
men, they are all medics. They don't go to the hospital.
Yeah, they think they know everything.
Wanaume to any hospital.
Yeah, and now we wrap it up at that point. I know you have many questions. You can drop them on the comment section, and our expert will get back to us with the answers. And we also have a phone number there in case of any question. You can ask. Remember to visit our
social media pages. Our Twitter at Desatmamba Production, YouTube Desatmamba Production. Yeah, TikTok Desatmamba Production. Like, share, subscribe, and tell a friend to tell a friend. Till next time, bye.
And remember, at Desatmamba Production,
we prioritize your interest.
Thank you, and bye.